In 1953, Dr. Jonas Salk developed a vaccine that immunized against a disease that affected the whole world. However, in many places, due to conflict, unstable infrastructure, access, and vaccine coverage, the immunity and efficacy of these vaccines is in jeopardy. One such country is the Democratic Republic of the Congo, also known as the DRC. Though the Congo has been polio-free since 2015, these factors, along with prolonged interruptions in service and coverage, put this country at risk and certain cohorts of the population at risk of reemergence of diseases that no longer circulate. Over the summer, I was fortunate to work with the UCLA DRC research program. Here, I was able to assist in a polio serosurvey, which looked to identify the gaps or identify immunization coverage within the Haut-Lomami province of the southern region of the Congo. Here, we worked for around a month, traveling to over 30 villages in 7 health zones. I want to give you a small background of the UCLA research program before I continue. It was founded in 2004 by Dr. Anne Remoyne. The program, along with local researchers and ministries, looks to assist in building the capacity and infrastructure of the DRC. The program also looks to collect data that is essential in implementing and providing information for prevention and control strategies. This summer program was focused, this polio serosurvey looked to identify some of these gaps. I can remember a very specific experience we had in the latter end of our study. It was about 3 weeks in. Everyone was very tired. We had all felt the strain of traveling miles and miles and miles in Land Cruisers on roads that you could hardly call roads, traversing rivers and going across bridges that would make you very uncomfortable. We had multiple flat tires, and we were sleeping in places that one might not want to sleep on a regular basis. This day, however, left a very unique experience in my mind, and it's something that's kind of stuck with me throughout this whole period. My group, 7 of us, crossed the lake on a small outboard powered wooden boat. We crossed the lake to the village of Bonwi. It was a small village in one of the 7 health zones. We crossed the lake without any drastic events. There was a little water that filled up in the boat, but nothing too extreme that we couldn't handle. As you crossed the lake, you could see dotted small villages on jetties and reed floats. Reaching the village, we saw all kinds of households. We saw children running around on the lakes and the sides of the riverbanks. But it wasn't this that stuck with me. It wasn't the lack of services. What really stuck to me was the isolation. As we went to collect our data and had kids sitting on the laps of their parents screaming as we collected very small blood samples with very small needles, I can remember just how isolated this village was. To think that health workers and health officials must try to provide services in some of these areas where we used extensive resources to get to was overwhelming. It clarified to me the importance of public health and global health and the research that we are doing within the UCLA DRC research program. It seemed to me that many of these populations, so isolated, so vulnerable, often don't get the service they're needed, not to the fault of the country, but to a whole host of issues. To be able to see how important this work is, not just from the United States, but as we expand ourselves in the global health capacity, I would like to thank the Global Health Fellows for providing funding for me to travel with the UCLA DRC research program. I would also like to thank Anne Ramon for allowing me to participate in the serological survey and to build skills that I may have never built. All those who are out here in the crowd, I implore you, if you're looking for internships, both domestic and global, to look at global health. It will provide you with an experience that you will never forget. This fellowship has allowed me to create a perspective and approaches that we may not get in domestic work. It may give you a perspective that allow you to look at things differently, provide a unique experience to your possible professors, co-workers, and employers. Thank you.